Assalamualaikum. My name is Muhammad Akmal Adam. I'm going to show you my day as a pharmacy intern in the emergency department. Emergency department is the first point of contact for any critically ill patient needing immediate medical attention. This department is not as busy as the other pharmacy department because we only deal with emergency situation. As a student, I start the day by recording and checking the prescription for the daily statistic of emergency pharmacy. After that, we just wait for the patient to come and get the medication. The most common medications supplied in this department are painkillers such as paracetamol and tramadol for maximum duration of 1 week. Other than filling medication, I usually spend my free time in this department by helping the staff packing medicines. The benefits that I gain during my attachment in this department is that I learn the workflow of emergency department, and because this department is not busy and hectic, I usually have a conversation with the pharmacists about their experiences and I gain knowledge from that. Last but not least, as a pharmacy student, we should at least have a basic knowledge before embarking our journey in hospital training, such as prescription screening and basic calculation.
Now, I'm going to explain to you about non-formulary pharmacy or NF in HUKM. Non-formulary pharmacy is a place where patients can buy medicines prescribed by the clinic. The medicines here are sought by indications. For example, reproductive hormones such as progesterone are placed in shelf A, psychiatry medicines in shelf B, supplements in shelf C. As you can see in this clip, Entresto 50 mg, which is used to treat heart failure, is placed in shelf M. There are two types of medicines that are available here. First, medicines that are not supplied by the main pharmacy. For example, patients from cardiology and orthopedic clinic are not supplied with calcitriol, so they need to buy it from non-formulary pharmacy. Second, over-the-counter products. These products are available without prescriptions, such as face cleanser like Cetaphil, multivitamins, and supplements. Finally, the pharmacist will dispense the medicines to the patient. During the purchase, some patients are eligible to get discount. For instance, if they have a letter signed by the eligible doctors from their respective clinics, they are able to get half price for the medicines. Otherwise, they need to pay for the normal price.
Hello, Assalamualaikum. My name is Amirul, and for this video presentation, I am presenting about the manufacturing department. In HUKM, the manufacturing department will receive orders from various departments and wards around the hospital. Before preparing the medication, the pharmacist will give the worksheet to students to be filled out. After filling out the sheet, we will start preparing the medication. In this picture, the medication that is being prepared is GTN ointment or glyceryl trinitrate ointment. After medication is finished, a pharmacist will check the worksheet and the drug compounded. The drug will then be sent to other departments or wards. While packing this medication, I will talk about the benefits and challenges that I gain as a student. The benefits will be that I am more accustomed in dealing and compounding drugs. This is important for us to gain real-life experiences in dealing with medications that eventually will be used by patients. The challenges will be that there are so many drugs to memorize. Memorizing all the drugs in manufacturing department can be quite hard, especially when we are given only 1 week to stay in that department. Before joining the practical session in the hospital, I will advise that students know techniques in preparing drugs, such as levication technique and aseptic techniques. Other than that, you should seek more knowledge about our course and have fun. That's all from me. Thank you.
Hi, my name is Izzata Fira binti Muhammad Rifin and my matrix number is 2020482034. I'm currently having my hospital training at Hospital Canselor Tuanku Mukhriz, Kuala Lumpur. And this is my day as a pharmacy assistant. I'm going to make a Capra syrup using 500 mg of Capra tablets. I will add the tablets into the mortar and I crush them into a powder. Then triturate until the powder becomes smooth and small in size. Then I'm going to add a little extem in the mortar and mix the mixture. And then I will mix and scrape the pestle to make sure all the powder dissolve in the stem, including the sugar coated of the tablets, and I will mix it. Next, I will add more stem and mix the mixture again. Triturate, mix and mix until it's become homogeneous, and then I will pour it into the bottle of 300 ml bottle, plastic bottle. And next, I will rinse the mortar by adding more stem and scrape around the mortar so that there's no left behind, and I can maintain the strength of the syrup needed. Adding more into the bottle. And next, I will add the extent to the volume that needed, which is 300 ml. Shake the bottle to make sure the mixture all mix until the homogeneous. And I can adding more stem until the level needed. Adding more and more. Last step, shake it again and recheck the volume of the syrup.
My name is Siti Izzah Atira binti Abu Sama with matrix number 2020457234. Today I am going to share about my day at TPN department. One of the job scope at TPN department is compounding and preparing TPN product. Before we start the compounding process, we need to wash our hand, and then we should do donning and gloving. TPN department prepares sterile products such as eardrops and also eye drop. We also compound TPN bag for patient. The other job scope is dispensing medication and recording room temperature. Next, the benefit that I get is I can practice aseptic technique that I learned during lab session. Last but not least, before entering TPN department, as a student, we should have a strong basic of aseptic technique.